Okay, so today we're really going to dive deep into some tough stuff, the impact of those U.S. funding cuts on South Africa's healthcare system.
Yeah.
And we're looking at this video report called South Africa, Healthcare Crisis Due to U.S. Funding Cuts. And it really, it doesn't hold back, like showing how decisions made so far away can have these really devastating consequences.
Yeah. I think it really does illustrate how interconnected global health is, wouldn't you say? The report really focuses in on the Trump administration's funding cuts and how those hit organizations like GREP, and they're, doing really vital work with survivors of domestic abuse and HIV prevention. And I think through Gerbeip's story, we can really see the human cost of these policy decisions.
Absolutely, yeah. It's not just about numbers on a spreadsheet.
Right.
The report actually shows, how GRIP had to lay off staff, close down programs. Like they even shut down trauma rooms that were specifically for survivors of domestic violence. And it's just, it's heartbreaking to see that ripple effect on a community that already faces so many challenges.
Yeah. And it's not even just about that immediate impact, right? I think what's so concerning is that these cuts are really undermining years of progress in the fight against HIV/AIDS. I mean, South Africa has made such significant strides in reducing the HIV/AIDS mortality rate, but this report is really highlighting how all those gains are now at risk.
It is. It's scary. It actually states that without adequate funding, HIV could become a leading cause of death in South Africa again.
Yeah. That's it's a chilling thought considering how much work has gone into, combating this epidemic. Can you elaborate on that a bit? Like, how did these U.S. funding cuts actually directly affect the progress that's been made in combating HIV/AIDS? Well, so for years, the U.S. has been like a major contributor to PEPFAR, the President's Emergency Plan for AIDS Relief.
Right.
And that's been so instrumental in providing antiretroviral treatment to literally millions of people in South Africa. And those treatments, have been really crucial in suppressing the virus, preventing transmission, and ultimately saving lives. But these cuts to PEPFAR, it means fewer people can actually get access to these medications, these life-saving medications, and it's really jeopardizing the progress that's been made.
Yeah. So it's not just about the financial support, but it's almost like the disruption of this system that was actually working.
Yeah.
That was keeping people alive, preventing the spread. It's what I found interesting is that the report doesn't just place blame on the U.S., but it calls on South Africa to kind of step up and become more self-sufficient when it comes to their healthcare system.
Yeah, that's a good point. I think while these funding cuts are definitely a huge setback, it also raises questions about South Africa's reliance on international aid. Is this like a wake-up call for the country to try and develop a healthcare system that's more sustainable and less dependent on that external funding?
Yeah. That's a complex issue. I'd be curious to hear, what a self-sufficient healthcare system in South Africa would look like. Like, what are the challenges, and how could they potentially overcome them?
Well, I think one of the biggest is resources, right? I mean,
Right.
building a really strong healthcare system requires significant investment in, infrastructure, training personnel. And in South Africa, they already face economic constraints. So finding those resources to fill the gap left by these U.S. funding cuts, it's a big task, And then there's also concerns about corruption and mismanagement within the South African healthcare system, and that could further complicate any efforts to kind of achieve self-sufficiency.
So it's not just about throwing money at the problem.
Exactly.
It's about making sure that money is used effectively and efficiently.
Right.
The report talks about the need for political accountability, for leaders to actually prioritize the health and well-being of their citizens. Do you think this situation could lead to maybe some positive change, within South Africa's government and how they approach healthcare?
It's definitely possible. I mean, this crisis could really be like a catalyst for reform, kind of pushing South Africa to address some of these systemic issues that have been plaguing their healthcare system for years.
It's almost like a forced evolution of their system,
Right.
brought about by these drastic funding cuts.
Exactly, yeah. This situation could really force them to confront those inefficiencies, address that corruption, and ultimately build a more resilient healthcare system, one that can actually serve its people better, even with all these external challenges. But of course, it all depends on whether there's the political will to make those changes.
Right. And, uh, the report, it really doesn't hold back on showing that despair felt by healthcare workers, who are losing their jobs and the
Yeah.
people who depend on these services. It paints a pretty bleak picture of the psychological and social impact these cuts are having, like on the ground.
It does. There's interviews with healthcare workers who are now facing unemployment, and their stories are just heartbreaking. They've dedicated their lives to serving these communities, and now they feel abandoned. They're unsure how they'll provide for themselves, their families. It's a stark reminder that these cuts have very, very real, devastating consequences on people's lives.
Absolutely. It goes beyond just the loss of services. It's about this loss of hope, the erosion of trust, this feeling of being left behind. And it kind of leads to another layer of this situation, like this ethical dilemma of relying on international aid.
Right.
Right.
It's relying on that external funding. While, it's well-intentioned, it can create this sense of dependency.
Yeah.
And this situation really exposes that. It also makes you kind of question the motives behind such aid.
Yeah.
Is it really just purely altruistic, or are there these other geopolitical or economic interests at play?
That's a really interesting point. It challenges us to examine the complexity of international aid and how it impacts the recipient countries. It's not a simple black and white issue.
Not at all. There are so many nuances, complexities that we often overlook. I think it's important to really understand the historical context, the power dynamics and the unintended consequences that can happen, even from the best intentioned aid programs.
Right. Yeah. It feels like we're kind of peeling back these layers of complexity here. On the one hand, we have this immediate crisis caused by the funding cuts.
Yeah.
But then on the other hand, we have this, this much deeper conversation about aid dependency and the long-term sustainability of these healthcare systems in developing countries.
Right, and that's really the core message of this report. It's not just about pointing fingers or blaming, but really encouraging that deeper analysis and exploring solutions.
Right, right. And speaking of solutions, the report does present this call to action.
It does, yeah.
It's not just about South Africa kind of figuring things out on their own, but it's a call for, global solidarity and rethinking how we approach global health.
Yeah, absolutely. The report really emphasizes that need for increased political accountability, both within South Africa and on a global level. And it really challenges viewers to think critically about the role of political leaders in ensuring the health and well-being of their citizens.
Yeah. It also really encourages viewers to get more engaged, to advocate for policies that actually put public health first and to hold our leaders accountable for the decisions they make. It's a powerful message that really goes beyond just the borders of South Africa.
Yeah. Yeah, it really reminds us that we're all connected, and decisions, that are made in one part of the world can have this ripple effect, across the globe. And the report, it doesn't shy away from the harsh realities, but it also offers this glimmer of hope, right? It suggests that maybe this crisis can be an opportunity for positive change, both within South Africa and in how we as a global community, approach these global health issues.
So what would that change? What would that look like? What are some concrete steps that could be taken to address these issues highlighted in the report?
Well, on a practical level, increasing funding for organizations like GRIP is critical. I mean, they're on the front lines providing those essential services to these vulnerable communities. And beyond that, investing in South Africa's healthcare infrastructure, training healthcare workers, and really strengthening their capacity to manage their own healthcare system. Those are all, really vital steps.
And from a more global perspective, what can be done to ensure that developing countries aren't left vulnerable to these political decisions made in other countries?
That's a huge question. I think it requires a pretty fundamental shift in how we view global health in general. We need to move away from this charity model and towards a more collaborative approach, one that really empowers countries like South Africa to really take ownership of their healthcare systems and build that long-term sustainability.
Yeah. It almost sounds like we need to rethink like the entire system, from funding mechanisms to capacity building, knowledge sharing, all of that.
Exactly. And this report, it really highlights the importance of moving beyond, those Band-Aid solutions and thinking more holistically towards a more sustainable approach to global health, one that really recognizes that interconnectedness of our world and the responsibility we share for each other's well-being.
Right. And that brings us back to that idea of personal responsibility.
Hmm.
The report really urges viewers to consider what they can do to make a difference.
Yeah.
What are some tangible actions that our listeners, could take, even if they feel like they're just one person in this vast, complex system?
That's a great question. I think it starts with awareness, educating ourselves about these issues, understanding the complexities, and then we can start to identify ways that we can contribute, whether it's supporting organizations like GRP, engaging in political advocacy, or even just having those conversations with our friends and family about these issues.
Yeah, so even small actions can have a ripple effect.
Absolutely. It's about recognizing that we're not powerless, that we each have a role to play in shaping a more just and equitable world.
The report ends on this pretty thought-provoking question.
Yeah.
It asks viewers, what responsibility do we have to each other's well-being in an increasingly interconnected world? And it's a heavy question, and one that really doesn't have any easy answers. What are your thoughts on that?
It's a question that really challenges us to look at our own values, our own priorities. I think in this world where we're constantly bombarded with information and we often feel overwhelmed by the scale of these global problems, it's really easy to become desensitized or to feel like our individual actions just don't matter. But this report, it really reminds us that, every single action we take, no matter how small, can contribute to positive change. It's about recognizing that shared humanity and taking responsibility for creating a world where everyone has a chance to thrive.
It's a powerful message. It's a call to action that really resonates on a personal level.
Yeah.
It asks us to think about our own role in shaping a better future.
Yeah.
And it's a reminder that even when faced with these seemingly impossible challenges, that hope and action are always possible.
Mm.
This deep dive has really been eye-opening for me. Just seeing those complexities of global health and the consequences of these decisions that are made, half a world away. It's been enlightening and sobering at the same time.
Yeah, I think that's the power of these kinds of deep dives. They challenge us to step outside our comfort zones, to really grapple with those difficult issues, and to engage in these conversations that lead to greater understanding and hopefully, positive change.
Yeah, absolutely. We've covered a lot today, from the impact of those U.S. funding cuts on organizations like GRP to, these bigger questions of aid dependency and the need for sustainable healthcare systems. It's a lot to process. I'm sure our listeners are feeling all kinds of emotions right now.
Yeah, it's understandable to feel, overwhelmed, maybe even a bit discouraged by the scale of these challenges, but I think it's important to remember that, we're not alone in this. There are so many people, so many organizations out there working to address these issues, and we can all find ways to contribute to those efforts.
Yeah, it's definitely been like a roller coaster of emotions, right? Like going from the shock of seeing the immediate impact of these cuts to the bigger picture stuff about, global responsibility and what the future of healthcare in South Africa could look like.
Right.
It's a lot to unpack, but it's like makes you want to do something.
Yeah.
It's really motivating in a way.
Yeah, I think that's kind of the point of these deep dives, right? It's not just about relaying information, but it's about sparking that desire to understand, to connect, and then, ultimately to act.
Yeah, one thing that keeps coming back to me is this idea of unintended consequences.
Mm-hmm.
We often think of aid as just this purely good thing,
Yeah.
But this report shows how complex it is, all these factors, the good and the bad.
Right. It really challenges us to think beyond, just the surface level and consider those long-term implications of everything we do.
Right.
Individually and as a global community, it's like well-intentioned things can have unforeseen effects, sometimes even harmful ones, and we got to always be reevaluating and adapting.
It makes you think about the power dynamics too, right? In these aid relationships. Like how do we even start to shift to a system where developing countries aren't just relying on this external funding, but they can build their own, sustainable solutions.
That's a huge one, and it needs a lot of different approaches. I mean, it's about investing in education, infrastructure, and capacity building in those developing countries. But you know, donor countries also need to be willing to shift away from that top-down approach and prioritize partnership and collaboration.
Right. So it's about, moving away from that we know best kind of attitude and more towards, like you said, collaborating, acknowledging that the communities we're trying to help, they have their own expertise.
Absolutely. Fostering those true partnerships where, both sides can learn from each other, work together to find solutions that really fit the needs and the context of the country.
I think this deep dive has really shown how important it is to really take informed action, right? It's not enough to just, feel bad or get angry. We have to channel those feelings into doing something that can actually make a difference.
I totally agree. It's about going from just, knowing to actually doing. And that means engaging with these issues more deeply, educating ourselves, questioning those assumptions we have and figuring out how we can be part of those real solutions.
So as we kind of wrap up here, I want our listeners to feel hopeful, not just discouraged. What are some things, even small things, that people can do to address these issues that we've talked about today?
Well, like we mentioned before, supporting those organizations like GRIP, that's a real way to make a difference. Even a small donation can go a long way.
And what about things beyond, money?
Well, staying informed is really important. Reading articles, watching documentaries, just talking about these issues, all that helps to raise awareness and keep the pressure on, the people in charge to really prioritize global health.
It's also about, being more aware of what we buy, supporting those businesses that have ethical sourcing, fair trade practices, and advocating for policies that really promote that global health equity. Even just having those conversations with our friends and family, all of that can add up.
Yeah, exactly. It's realizing that what we do, the choices we make, they all have this ripple effect, and by making conscious choices, we can all work together to create a more just and equal world.
I think this deep dive has really shown us, that we are all connected. That what happens in one community or one country, even one continent, affects us all.
Yeah, it's a really powerful reminder that we have to, we got to take care of each other and work towards a world where, where everyone has that opportunity to thrive and never forget that human impact of what we do, however far it reaches.
Yeah, it's definitely a lot to think about, but it's also it's really inspiring.
Well, to everyone listening, thanks for joining us on this deep dive. We hope it's made you curious, maybe sparked your passion for making a difference and giving you that sense that you can make a difference, even in the face of these big complex issues. Remember, even those small actions add up, and together we can make a real positive change that goes way beyond just ourselves.